Welcome to July support group meeting. To those who have been with us before, it's good to see you. For those who this is your first time, I'm so glad you decided to spend your time with us. This support group doesn't exist without you, so you're very important to us. My name is Kira. I usually co-host with Lanice, but Lanice is out for today. We are thinking of her. This is my first time hosting, so bear with me. I will be awkward. First, I'd like to thank our generous sponsors, Johnson & Johnson, CVS, Merck, Gossamer Bio, and Liquidia. I'd also like to plug some of our programs with Team Phenomenal Hope. The first one being Let Me Be Your Lungs. Let Me Be Your Lungs is a program where they have run walk activities where an athlete sponsors you and participates on your behalf in those events to raise awareness for pulmonary arterial hypertension. If you know somebody that is interested in doing a walk and sponsoring you, you can go ahead and sign them up in any kind of like triathlons, marathons, etc. It's a pretty popular program. I happen to be sponsored by Dr. George, who is my pulmonary doctor. She's amazing. And she also does a lot of work with Team Phenomenal Hope, and I believe is a co-founder. Another program that's really important to us is the Megan Michelle Hicks Fund for Unmet Needs. This is specifically for pulmonary hypertension patients. It must be for needs, not a want, and it cannot be used for medical purposes. Those usually open up on the first of the month. We have an application that's available through the Megan Michelle Hicks Fund on the actual teamphenomenalhope.org website. So please, at the first of the month, if you haven't signed up for it, go ahead and give it a shot. They just ask for information about yourself, a little bit about your story, and then they give you some further information if you're accepted, and some of those funds get sent to you. It's a great program and really helps offset those things that you need in your household, like groceries, gas, fixing up your car, that important stuff that sometimes gets sidelined because of your medical needs and finances that end up being, passed on to medical things instead of the stuff that you actually need, like bills. I know I've personally used it before. It's been a big help. And I definitely suggest you to do it. That's the first of the month. I'd also like to talk about the peer-to-peer program that we have. It's where patients can talk to other patients. If you are struggling, if you need somebody that knows exactly what you're going through and has a very similar story to you, this is a great program where you can be paired up to another patient and actually have someone to vent and get some of that off your chest. I know from personal experience that family doesn't always understand. They care, they commiserate, but they don't understand what we're going through. And so having a peer that does understand makes a huge difference. Also on the teamphenomenalhope.org website, if you go to their peer-to-peer, you can actually look at the different bios for the separate peers and pick one that may fit with you. If you talk with them and it still doesn't fit, not a problem. You can go ahead and try another peer. I'm a peer, Lanice is, we have a couple of others. I definitely suggest trying out the program if you need somebody to talk to. The next point is we have our next support group meeting is on September 10th. We have Chef Keisha. She is amazing. She makes some of the most delicious and beautiful foods I've ever seen. She sells stuff on her website. She's going to be doing a support group meeting on the benefits of cooking with fresh herbs. I always love having her on. She is amazing, very personable, very intelligent, and great sense of humor. You absolutely should join us for September 10th. That's 2 p.m. Eastern time, 12 Mountain Standard Time. I'm in Denver, so. Yeah, so that is that. I think I got everything. I'm going to go ahead and introduce our guest speaker today, who's going to talk to us about pulmonary rehab, Dr. Vijay Balasubramanian, and he's going to, he's going to go ahead and talk to us. And he would like it to be very informal. So if you have questions, please raise your hand. We are going to keep everybody muted during the talk. But if you raise your hand, just for those who don't know, go to the bottom of your screen where it says reactions. If you click on that, it should have a raise hand option. When you raise your hand, Kathleen will get to you as soon as possible, and she will go ahead and get your question aired. So please, please ask your questions. And again, I would like to introduce Dr. Vijay. Thank you so much for being with us. We really are looking forward to this talk.
Thank you, Kira, for the introduction. I run the Valley Advanced Lung Diseases Institute here that was just founded 2 years ago. Previously, I was an academic teaching professor at UCSF Fresno, where I kind of built my own pulmonary hypertension program, which we were very fortunate to get a national standing from. But anyway, we moved on, and this practice is pretty much dedicated to patients with advanced lung diseases such as PH and ILD. And I've had the good fortune of working closely with Team Phenomenal Hope and also serve on the board of Team Phenomenal Hope. So patient support group and providing patient support and education has been very dear to my heart. And as you all know, my patients are on the panel today, and they can also talk about it when the time comes, but they've been very instrumental in playing a big role in our local program here at Central Valley of California. So today we are going to talk a little bit about cardiopulmonary rehabilitation and PAH. And as you know, all of you have this is such a difficult condition, as all of you know. And we'll talk a little bit about just one or two slides about PAH. These are all fairly basic slides, and feel free to interject. I'm not going to delve too much into the details, but you all know what PAH is. It's the progressive narrowing of the small blood vessels within your lung. Blood vessels kind of narrow down over a period of time, increasing the resistance so the blood cannot flow through it that easily, and therefore it's subject to high pressure. And therefore the oxygen, because they are so thickened and they are narrow, so oxygen cannot flow very easily from lungs into the blood. And this kind of trend continues as depicted in this cartoon. As the progressive narrowing happens, the top panel shows the blood vessel and then how this narrows down over a period of time. Eventually, you go into this vicious cycle of reducing heart function and your right heart failure that happens, which can eventually lead to the event of death. So the cartoon basically says there's only so much a donkey can pull, and that's what a right ventricle is. It's kind of the analogy is right ventricle is the donkey. You can only load the donkey so much, and eventually the donkey is going to fail. Okay. So we have, as you all know, 5 different types of pulmonary hypertension, group 1 to group 5, and they are basically classified based on how one develops high blood pressure in the lungs. The narrowing, progressive narrowing of the blood vessels, which I spoke to you about, is the one that's referred to as PAH. So when you say PAH, that means it automatically means group 1 pulmonary hypertension. So group 2 is when you have heart disease, where left heart disease, where the blood backs up into the lungs and causes high blood pressure in the lung circulation as a result, which is the commonest type of pulmonary hypertension. And that is called group 2. And that is all the medications that are currently available in the market for pulmonary arterial hypertension will not work for group 2 pulmonary hypertension. They are only for pulmonary arterial hypertension. And group 3 is when you have lung disease like fibrosis, COPD, those kind of conditions that can eventually, the more disease the lungs develop, they can develop high blood pressure in the lungs as a result of that. And therefore, we call that group 3 pulmonary hypertension. And then group 4 is basically when you have old blood clots that can not fully resolve, but basically block or clog up the system over a period of time and increase the blood pressure in the lungs. It works very similar to group 1, which is pulmonary arterial hypertension, only because the narrowing here is because of old clots and not because of actual tissue change. So presentation-wise, both are very similar, but it has its own distinctive group, and that is why we call it group 4 due to pulmonary arterial obstruction. One of the common ones there is that long name, which you might be very familiar with. It's called CTEPH, chronic thromboembolic pulmonary hypertension. And then group 5 is basically a bag of conditions that we know that they cause pulmonary hypertension, but it's little unclear or less clear as to what is the mechanism through which they cause pulmonary hypertension. So we put them in group 5. Okay, so basically what we are going to be focusing on is group 1 or pulmonary arterial hypertension. So this is the same thing illustrated in a different cartoon, but I'll move on. The only takeaway here is group 1 is a rare disease, and we can see the cartoon here saying one little person here. Group 2 is the commonest type of pulmonary hypertension. You see many people here. Group 3 is the other common pulmonary hypertension. Group 4 and group 1 are rare, and obviously group 5 is also rare. And just so you know, pulmonary arterial hypertension is still part of the National Organization of Rare Diseases, NORD, from the NIH. So you're all familiar with this. I'm going to just speed through this so that we can get to the crux of it. The common symptoms are shortness of breath, fatigue, some chest pain or chest pressure. Some people can have dizziness or syncope. And this is usually because as the heart weakens, it cannot pump enough blood, and therefore there's not enough blood going to the head or to the toe. So people can feel dizzy with just doing activity. You can develop swelling, you can develop some heart palpitations, and sometimes in advanced disease, you can have cyanosis. Did anybody raise their hand by any chance? Are there any questions?
No, no, but there is a written question.
Okay.
It says my husband has pulmonary fibrosis and PAH. Does that put him in group 1 or 3?
It's a great question. So that is an individual should really ask that question to their respective doctor, but I can give you a general idea. Some people can develop high blood pressure in the lungs due to the lung disease. But in some situations, say for example, if somebody has a condition called scleroderma, which can predispose them to both pulmonary fibrosis and pulmonary arterial hypertension. So you can have PAH and you can have pulmonary fibrosis coexist in that patient, which is unfortunate, but that is the case. Usually the distinction is patients with PAH will have very significantly high pressures and high resistance values, whereas if the pulmonary hypertension is due to the lung disease, usually the lung pressures are not as high as PAH. And again, this is, I don't want you to think of it in black and white terms. This is kind of a spectrum, and the more specific aspects of it needs to be addressed with the individual treating physician. Hope that answers your question. So moving on. So when somebody develops pulmonary hypertension and they kind of develop a little bit of fatigue with that and some shortness of breath, that often becomes a vicious cycle. You develop a little bit of reduced exercise tolerance, and then patients lose the motivation as a result to they can often be frightened to move around. And the inactivity and the chronic thing can lead to muscle weakness, and that becomes like a vicious cycle. How many of you can identify with this type of a vicious cycle in your lives? Okay, I see some hands going up. Okay, the number of people I can see here. So now, this is a very easy slide for you to remember. These are the current pathways. We now have 4 pathways for pulmonary hypertension, but I'm not going to explain this to you because I've simplified it for you. Okay, so this is the cartoon version, which I generated through using AI. So basically, it's the endothelin pathway, the nitric oxide pathway, the prostacyclin pathway, and the new pathway that has been introduced is the activin pathway, the activin inhibitors, Winrevair or sotatercept. So and now we have 4 pathways, I mean more than 16 different medication, and I'm sure most of you are on some or all of these pathways type medication regimen. But apart from the treatment, what else do you need? So I always tell, when a patient says to me, how can I help? I help, meaning to say the patient, can help improve my condition along with my PH treatment team. So I kind of have this conversation where the doctor's job is about 50% to provide expert advice and direct the patient. And then there is another 50% of responsibility on the patient's side, so as to what they can do. And that would be some of these, like dietary modifications, doing some healthy dietary things to kind of lose weight, eat healthy, that kind of stuff, stress management, avoidance of smoking, compliant with your medications and oxygen, making sure your physical activity level is good, control your weight, and again, some supplements. But if you notice, pulmonary rehabilitation plays a very crucial role in some patients. So let's talk a little bit more about pulmonary rehabilitation. So what happens in this program? So before pulmonary rehab program starts, the healthcare team may ask a person to do one or more of the following tests. A 6-minute walk test to gauge the capacity for exercise. Pulmonary function testing to evaluate breathing. Exercise stress test to measure heart rate, blood pressure, and oxygen level during physical activity. And then when the program starts, it'll include exercise training to build your stamina and flexibility. And it'll also include some of the following: some breathing techniques such as yoga to help ease the sense of being out of breath, and instruction in finding easier energy-saving ways to do everyday tasks. Obviously, smoking cessation when needed, they might provide some help with that. And psychological counseling for mental health issues, and nutritional counseling for some optimal health. So, and then at the end of the rehabilitation, the healthcare team may retest a person to see how much their breathing has improved. Okay, so that's kind of how, in a nutshell, and every program might have little nuances in which they can differ a little bit, but this is kind of the general idea. So what are the benefits of pulmonary hypertension? So these are evidence-based things that have been shown by pulmonary rehabilitation in PAH patients. One, it can reduce dyspnea or shortness of breath. It can enhance quality of life. It can increase muscle strength. Okay. So as a result, if you look at the lungs, it can improve your gas exchange. There is a thought process that think that it may have a positive effect on pulmonary vascular remodeling. This is just a thought process. It may reduce the inflammatory response. It may reduce the oxidative stress. These are all some of the initial study kind of preliminary findings, so to speak. And then some feel that there could be some positive effects on right ventricular remodeling. Right ventricle is the part of the heart that pumps the blood into the lungs, as you all know. And right ventricular function obviously is absolutely crucial in determining outcome for a patient. So from a blood perspective, the pro-inflammatory cytokines, which are chemicals that help with inflammation, can actually be reduced with the pulmonary rehab. Immunity can be enhanced, strength can be enhanced, anaerobic threshold, meaning to say the amount you can work before you start you, kind of going into a metabolism where you don't need oxygen, that can be increased. That threshold can be increased. And obviously, the capillary density, meaning to say blood vessel volume within the lungs, can be increased. So what about improving exercise capacity and physical function? So it can work in a few ways. One is it can help with the brain's desensitization to shortness of breath. It can help with that, so you don't feel as short of breath. It can reduce your anxiety, reduce your depression, and a reduction in the ability of kind of your lungs. This applies more towards patients with COPD, less to patients with pulmonary arterial hypertension. But it also improves skeletal muscle function. And some people can monitor the exercise capacity depending on center to center, where using a 6-minute walk distance or using a cardiopulmonary exercise testing, which we don't do in our center, but some centers do that. Okay, so again, the cartoon on the right side kind of enhances or explains, illustrates the same thing. So positive effects on symptom development, improved muscle strength, allowing the patients to be more active, and improvements in fatigue. And obviously, enhancing quality of life. So it has been shown to improve quality of life scores in various studies, reduce symptoms like shortness of breath and fatigue, alleviate associated anxiety and depression. And if you wonder, is this approved? Yes, it is approved by Medicare, which generally covers pulmonary rehabilitation for qualifying patients, including those with pulmonary hypertension, when it's deemed medically necessary. Medicare Part B usually covers pulmonary rehabilitation, and individuals with Medicare Advantage Part C also have the coverage. However, what I do not know is how does the big, beautiful bill affect all this? That will remain to be seen. With that, I will conclude my talk with a big thank you to all of you. I wanted to keep it brief to allow time for questions and time during the talk, but I'm happy to take questions. And this is our last support group meeting that we had, and a big thanks to my entire team. And you can see Rachel right there in the center. And a big thanks to Team Phenomenal Hope for putting this together, and look forward to another opportunity to talk to you about a different topic.
So Kira has her hand raised.
Yes, Kira?
Hi. You mentioned that Medicare covers that. What about Medicaid?
Medicaid is state dependent. So it's a good question. Medi-Cal in California covers it, but I can't speak for other states. It all depends on state to state. That's an excellent question. Access to pulmonary rehabilitation can be a challenge. You're opening an entire can of worms out there. I don't know whether there is a central database. I can speak for the Central Valley of California. There is hardly any pulmonary rehab here. The only place that offers pulmonary rehab is Fresno here, where I am, and one hospital. That's it. And so I totally understand your challenge, and that is something that you have to talk to your local PH program as to who are the pulmonary rehab centers in and around your place and within your vicinity. I don't see any reason why you have to go to a center. If you have a pulmonary rehab center that's closer, that should be very much the more important thing is you attend a rehab thing rather than driving miles together and sitting in traffic and things like that. So that is something that you need to talk to your local center about. But it's a good question. Great question again. Again, it varies from place to place based on their own rules. In our program, we do 6 weeks of pulmonary rehab twice a week, and that can be arranged. That's just a skeleton. And say if a patient is coming from a great deal of distance, which a lot of our patients do, then they can individually talk to pulmonary rehab and count the number of sessions per se to make up for that 6 weeks, so to speak. And that still works. And most of the time, pulmonary rehab, even if it's not covered by insurance, it's actually very cost effective. In our rehab facility, uh, I don't know whether things have changed, but it used to be just $5 per visit. And they can just pay out of their pocket and come for the rehab. That is kind of what they used to practice. It's been a while since I spoke with them, but it used to be their practice till recently. And you can check with it's a very low cost, in a high cost condition like pulmonary arterial hypertension, where all the medications cost so much and things like that. Pulmonary rehab is a fairly good low cost adjunct therapy. I have to emphasize that it's going to be adjunctive to your PH therapy. It cannot be therapy by itself. Great question again. I don't know whether I can answer that right here. That is something which there is enough pulmonary rehab based exercises on. Again, don't quote me on this. The best thing, official thing to do is to go to your respective pulmonary rehab people and request a set of exercises and that you can practice at home. Or there are quite a bit of YouTube videos on exercises that you can practice at home, including breathing yoga type of, when I say breathing yoga, these are not all the fancy stuff which you see people do where they kind of twist their arms and things like that. Very simple breathing exercises that one can do. And all these are, YouTube is a very great resource for you to find some good videos on this. But my advice would be to first, if you find there's a lot of other, unfortunately, for the lack of a better word, nonsense videos as well. So please check with your physician, check the YouTube source, make sure it's a standardized source before you start practicing it at home. And always touch base with your PH team before you start doing something, because everything is very individualized. A very symptomatic patient who has not been on treatment yet or not on adequate treatment as yet, you need to be cautious about engaging in significant exercise. That's why it's important to talk to your respective PH team or physician about pulmonary rehab as to what is appropriate for you.
There is a comment that says PHA has several good videos, I guess, on their website.
And that would be fantastic. I'm sorry that I haven't seen those videos, but
Okay.
if PHA has it, then that's great.
Yeah. And also Tris comments, if your doctor approves pulmonary rehab, there are several resources that they have online through the PHA Association and Pulmonary Wellness Foundation. And then there's Noah Greenspan, who has several online rehab exercises and classes.
Absolutely, Kathy. Thanks for sharing that. But again,
Sure.
the most important aspect I would emphasize is please individually talk to your PH team before you engage in rehab, because each person is different and they may be on different parts of their PH treatment and severity. And as you know, it's a very complex disease. So check with them before you start on any exercise regimen.
definitely.
Again, a fantastic practical question. May not be immediately, but if there is I think after a certain window of time, there is a need for a repeat pulmonary rehab thing because of change of status and things like that. I think it is approved. A lot of my patients have gone for repeat rehab things, but say if you finish 6 weeks and then you, oh, I really like it and I want to go for another 6 weeks, that may not be approved by Medicare because you're just following it up with a 6 week course. But if you give it a year or so and then you want to go back, I think you should be okay. But again, each individual regulation might change from place to place, so please check. But the general answer is yes, after a certain time duration. Great. Very good practical question. So, generally, pulmonary rehab is an adjunct therapy on somebody
Yeah.
who's already been diagnosed with PAH
Yeah.
and is on appropriate treatment and shown good improvement. And mainly for patients who have had a previous situation when they've been in the hospital, they feel deconditioned, and they have to get back to their life again and things like that. Now, for example, again, I know you didn't mean that, but I'm going to be proud about you in front of everyone, if that's okay with you. This is a guy who is on quadruple therapy for PAH, and he's competing with other individuals, normal individuals, and ends up winning the tournament. And he said, I felt tired after the tournament. I don't know what to say for that. It's really meant for patients who are feeling deconditioned physically. They are afraid mentally and physically to walk or try something because they are so limited by their condition that the pulmonary rehab will help those patients to put the whole physical and mental mindset on the positive
Yeah.
side of things so that they can enhance their physical activity, improve their muscle strength, and improve their mental strength in the process. Yeah. So first of all, it's I want to tell you that the person you're going to in New Mexico is a great friend of mine, and you are in great hands. Okay. So, and you will be in very good hands, and she is extremely good. We share the same passion with regards to patient education and things like that. So, and going to an elevation, if you already are on oxygen, you're going to need oxygen during the day, most likely. And that is going to be determined by your physician over there. Because there are some tests that they can do whether you need oxygen supplementation during the day, if you're living in a high elevation, especially with what we call supplemental oxygen when you're doing some activity. And obviously, you will continue using your oxygen at night as well. But I think staying positive and staying active like the way you are doing is you're already doing all the things what one would expect people to do. But I don't think there's anything else for me to recommend on top of that for you to prepare to go to a elevation. Elevation, when you go to an elevation, it's a low oxygen, low availability of oxygen situation. So that has got not much to do. So the stronger you are, the better you are equipped to deal with that. But the fact is, because you have PAH and because you're already on oxygen, the likelihood of you needing more oxygen, particularly during the daytime, might be increased. And that is something you can talk to your new doctor at University of New Mexico. The entire point of oxygen is not I'm sure all of you monitor your oxygen levels using a pulse oximeter. So feel free to monitor your pulse oximeter from time to time. You don't need to keep looking at it all the time, But as long as for the vast majority of time, it's kind of 88 and above or 90 and above is good enough. Please don't, one of the common things what people think is, oh, it used to be 97, 98, now it's 94. Should I be worried? No, as long as it's 90 plus, you're okay. It's what we don't want to see is a lot of patients lying in the early 80s and not using oxygen, because then that can cause dizziness, headache, and fainting episodes, and eventually worsen your pulmonary hypertension over a period of time because your body is being exposed to a low oxygen level for a prolonged period of time. That is what we are trying to prevent by your oxygen supplementation. So as long as you're being proactive about your oxygen, wearing your oxygen, doing all your day-to-day activities, keeping your oxygen saturations above, you're good. All right. Well, if that's okay with you, I have some patients waiting. I have to move on. And if there are any other questions that come up, feel free to email. And Tanya, would you mind sharing that with me? I'll be able to answer it online. Okay.
Yes, sure.
Thank you so much, Dr. Vijay. We really appreciate this talk. It was really, really, really well informed. I appreciate it.
Thank
Yes,
you
thank
so
you
much,
so
guys.
much.
Appreciate it.
And
Yes.
thanks everyone for joining us today. Have a good
Thank
Just a
you.
quick reminder to people, the next support group meeting is is September 10th at 2 p.m. Eastern Standard Time. And it's with Chef Keisha, Benefits of Cooking with Fresh Herbs. Please don't forget to register. And I believe we'll also be getting a survey after this sent to your email. We would love feedback that you can improve on, any kind of additional ideas for meetings. What kind of meetings and speakers do you guys want to hear from? We would love that kind of input. So thank you everyone for coming, and we hope to see you next time.